our next speaker, because we will move on to the next topic while that presentation is being located. Dr. Akshay NAIR is going to speak to us on surgical training opportunities abroad. Dr. Akshay is a prolific and very erudite oculoplastic surgeon and researcher, and he's had this wonderful opportunity, and he'll guide us on these sort of special niche opportunities that one may try to avail of. Akshay, over to you.
Thank you. AV team, can you
project the slide, please?
Right. Thank you. So one of the things that, just a show of hands, how many of y'all are in training or within the 3 years of having completed training? In residency, in PG, or within 3 years of having completed? Okay, so that's good to know that this is the target audience whom we are talking to. So wherever I have had residents who want to ask me about going abroad for training, I ask them why, and these are the most commonest things that I get to hear. Because presumably they would, they think the training abroad is better, it's more cutting edge, they have better research opportunities and to find out more niche specialties that they can get into. More often than not, it's a stepping stone to moving and shifting base and living in another country, working there and moving there permanently, immigrating. In case they want to come back, it's just the prestige of having trained at a better institute abroad to increase your networks, to connect better. So if this is one of your motivations to think of training abroad, then it's possibly good. When should you not consider moving abroad or training abroad, or when things that you need to reconsider is when you're not sure what you want to learn by going abroad. If you've just completed residency here and you haven't done a subspecialty fellowship and you want to go ahead there to do a subspecialty fellowship with the aim of coming back to India and practicing, or you just training abroad and doing an international fellowship but planning to settle abroad, well then try to go the conventional route. So I'll cover a few places, primarily UK, US, a couple of other places, and the organizational support fellowships that we have, which is the ICO, the Ophthalmology Foundation, the AP-SOPRES, the APAO. So a good starting, if you're, and I'll say this 2-3 times during my talk, the best time to have started your preparation for a fellowship abroad or for moving abroad was yesterday. The next best time is today. So you may be in your second year of residency, but in case you want to move abroad, you need to do the groundwork now so that you can put the ball in motion. So a good starting point is to look for jobs on the NHS job search website, where you can put in a specialty, put in a location or not, and just hit search. You'd end up getting places where you have, say, a vacancy for a senior clinical fellow with an international oculoplasty or a specialty doctor. You'll also have openings for fellowships. Similarly, each of the hospital websites, say like the Move Fields, will also have their listings for openings for fellowship, especially if they're looking for an international fellowship. You can click on all of them and they'll tell you what is essential. They'll say that GMC registration is essential. And as Sir and as Dr. Rashmin and Devendra have all mentioned, FRC-OFT is required. FRC-OFT is desirable, primarily because that's how you'll be able to practice there. So how do you go about doing your getting into the GMC? The first thing is your EPIC verification, which is the electronic portfolio of international credentials, which is an electronically done thing where your medical license or medical degree is verified. You always, regardless of whether English is your first language of proficiency, you will still need a certificate of English proficiency, preferably the IELTS or the OET. And then is the PLAB, the MLE, or the AMC, your licensing exam, which your FRC-OFT helps you avoid or helps you not have, it's no longer required. If you've cleared your FRC-OFT, you're exempted from PLAB. Or if you've got the USMLE, then great. So, which means that you have to do this. As he mentioned, what FRCS Glasgow does is that it allows you to be registered in the GMC, but you have to go through the CESR CP pathway, which is something known as the Certificate of Eligibility as a Specialist Practice in the UK. which has a separate pathway in which you need to get that. There is also a route called the FRCS MTI Dual Scholarship. Now, the Royal College of Ophthalmologists has a dual sponsorship scheme which allows international medical graduates to undertake specialty training there for a limited period of time, specifically 24 months. Now, dual sponsor means that someone from the college end or the UK would be one of your sponsors. Someone from India would be one of your other sponsors. When they say sponsor, they don't mean paying money for you to go there. It means vouching for your training and credentials. Now here, by virtue of having done your FRCS, the Royal College will act as one of the sponsoring body from there, and you will need a mentor or a person who's vouching for your skills and knowledge and proficiency to be the other sponsor from here. The sponsor in India will also attest to your skills. There will be an interview from both ends. You need your letter of recommendation. And then this is valid only for a training period of up to 24 months with the intention that you're expected to come back to your native country and work. However, there is a possibility that if should you get a better opportunity, you can switch over to a tier 2 visa, which is a work visa, which then could allow you to settle there for a longer period of time. So that is a general overview of how you have opportunity. So basically, if you need surgical training in the UK, you have to have cleared your licensing exam. Observerships, short-term observerships, a clinical observer, research observerships can be directly applied to the hospital. Remember, you're not touching or operating patients in those clinical or research fellowships. So those are allowed for you to apply without getting your licensing exams. For the US, in case you're looking for, again, surgical training, there a residency requirement is absolutely mandatory, for which you need to have cleared your MLE in all 3 parts. However, the license to practice can be given by certain state boards, state medical boards, such as California and Louisiana, and a couple of others, I think Kentucky also does, where international foreign medical graduates, on the recommendation of the university or the hospital, can issue temporary practicing licenses to them, which is why in California, there are multiple surgical training programs where international trainees can come in and get hands-on training, such as these prominent programs for oculoplasty in the University of California, San Diego, and University of California, Los Angeles. Singapore, there are 2 primary institutes that offer long-term and short-term fellowships. Long-term fellowships are available at NUS, that is the National University of Health Singapore, for international candidates. SNEC, the Singapore National Eye Clinic, offers only short-term clinical fellowships. These are fellowships that are directly applied for at the institute. They would interview you, and based on the process of recommendation of the interview board, you're offered the position. They would then give you a temporary licensing registration, which allows you to operate under supervision, basically as a trainee. But for this, you need to have completed your residency in India, preferably have a Royal College certificate as well. So if you've cleared your FRCS, either Edinburgh or Glasgow, that is a plus point, but that's not mandatory. A simple MS or DNB holds good. You are, however, not allowed to continue practicing in Singapore. So these international temporary licenses are given to foreign medical graduates with the intention of coming back. Short-term fellowships range from 3 to 6 months with limited or no hands-on. Long-term fellowships can be 1 year, 15 months, or 18 months, where you are given surgical training under guidance, but are expected to come back after training there. Most commonly offered fellowships are cornea oculoplastics. Now, training options in RANSCO, in Australia and New Zealand, are available on the RANSCO website, where they have you can look up if each of the hospitals and directly apply there. However, again, you need to be registered. You need to have the medical license there. The Indian medical degree is not valid, and you need to go through. They have a set of exams. Research and observation fellowships are available there, but surgical fellowship opportunities are incredibly rare. Like I said, Some hospitals allow you to bypass these routes and you can directly apply to them based on their availability on their website. Prominent ones being Moorfields and the Wilza Institute in Philadelphia, where they are willing to accept foreign medical graduates with limited hands-on training that is offered at their end. ICO fellowships, there are short-term 3-month, 6-month fellowships as well as long-term fellowships 1 year in all specialties that are offered based on the application process, which is a separate talk on its own. The ICO exams, to have cleared them, is preferred but not mandatory. Again, if there are certain places with whom you have connected on your own, which are not in the ICO host directory, you can write to the ICO and say, hey, I have cleared my ICO exams. I want to do a 3-month observership or a fellowship at this hospital. They are willing to absorb me. They are not listed as a host on your website. Can I still go? They'll be happy to accept it. Things to remember before I conclude. Remember, most of these fellowships are rarely funded by the host. You need to get your own visa and funding in order. The timeline is most important. Most of these applications, from the time of application to the fellowship going live, is at least 24 to 48 months. So you need to plan 2 years in advance of when you're planning your fellowship, which is why residency is a good time to start planning, to build up your CV, to have publications and conference presentations. Even a poster or a video at any conference is good because that shows your commitment. Also, an option could also be going to the same institute and doing a short internship or observership just to dip your toe in the pool to see how it is and then go. Always meticulously maintain a logbook for your benefit. You never know when it is useful. Every case that you've seen in the OPD is not possible to record that, but at least every surgery done, every surgery assisted or observed. The AAO website has a global directory of training opportunities with over 800 fellowship opportunities, both short-term and long-term listed, and they are classified based on specialty, duration, and country. This is a YouTube talk which is uploaded by Dr. Anuj Soni, he has a popular channel called Clinical Peanuts in Ophthalmology. It is a very interesting video or a podcast where a lot of different people have given different points of view, essentially similar to what this panel discussion is. So I would strongly recommend that you also go and check this out. Thank you so much for your time.
Thank you, Akshay.